South African healthcare workers in the front line of the COVID-19 pandemic are certainly having their challenges sort of meted out as this virus intensifies. In recent months, healthcare workers lamented the inadequate supply and allocation of protective equipment. Most workers also complained of poor working conditions at some of the state hospitals. To help us understand how healthcare workers ought to be treated, something I think we should all know by now, let's bring in Dr. Angelique Coetzee, who's chair of the South African Medical Association. Dr. Coetzee, thanks very much for your time and welcome to the AM report. I mean, in the backdrop of our conversation, of course, is that bleak picture painted by the public protector yesterday, who really went to great detail trying to help us understand the plight of some of our healthcare workers, even at this late stage of the pandemic. I just want to hone in on some of those details if I can. For instance, at Lilian Ngoyi Hospital, we found out that new mothers were actually left to their own devices to give birth on the floor without being provided things like heaters, nutritious food, while geysers actually hadn't been made available for them to access things like hot water to bath. It really sends chills down anyone's spine, but I wonder how much of this is actually new.
Morning, and thank you for asking Salma's views on this. Salma's been saying this for many months now, especially since the COVID pandemic started. We first were very unhappy about the PPEs, and then we found out that there's not electricity at some hospitals, running water at some hospitals. It's basic needs. No soap at some of the hospitals, but you expect people to wash their hands. We have complained, and so far it didn't help us a lot. So we need to go back to the drawing board. Because if these circumstances are carrying on in the future, and no one is listening to us, listening to the doctors at these hospitals, listening to the nursing staff, then something needs to be done. I cannot, at this stage, say what I think would be a way forward, but it can't be business as usual. For a whole year we tried, and I am extremely grateful to the public protector for being honest and telling that it is as it is. Because how many times have we seen that there is ministerial committees going to doing investigations at these hospitals? They also make reports and also saying that, the circumstances are not favorable. But one way or another, it never gets into the news. It never gets discussed. As it is currently, there is no money to employ new doctors. There is no money to fix a healthcare system. On top of it, the minister's got a mandate. He signed on a 10-point plan that he needs to deliver. And I can promise you, it's not going to happen. I have said this before, that he's set up for failure in a lot of these expectations of making the healthcare system better. We have to start at the root.
Yeah, and for people who aren't necessarily in your sector, Dr. Coetzee, what does starting at the root actually mean? I mean, is this a matter of having a complete overhaul of the system from the top down, or is it a matter of just trying to agitate for a whole lot more political will to finally addressing these issues meaningfully?
Well, I think it's because of the political interferences and political employment that we are where we are. Also, employment of people in positions that they never should have gotten because they're not qualified. They do not have the experience. So if we do not start and look at everyone's post and be bold enough to say, listen, you are the CEO of this hospital. Look what is happening. Show me, what did you do to try to fix this system? And if you can't fix the system, then you need to make noise. If you don't make noise, you accept the system.
We've seen instances where it appears healthcare workers have become disillusioned. And I guess now that we're understanding the nature of the problem, one has to be, in some respects, sympathetic towards that. But how then do we give ourselves an even fighting chance at trying to beat COVID-19 when, you know, things like staff morale are compounded by systemic inefficiencies?
It's very, very difficult. So if you look at the public hospitals, just make a survey and see how many public hospitals and clinics are reporting on a daily basis their COVID-19 cases onto an electronic healthcare system that's there for them to report to. It doesn't happen. So we don't even get the figures of what is actually happening in the hospitals. I don't, you know, we are producing medical doctors, but then we do not have work for them because of a lack of money. And the same with nursing staff. Then we're wondering why people are leaving the country. But you can only do so much. You can only ask so many times. Please open up the posts. So this is not only National Department of Health's problem, it's also a treasury problem. And it's also a problem with public works. And the system needs to be overhauled.
Sure. Whilst, of course, in the backdrop, there is the issue of COVID-19, and what's adding to the complexity now is this new variant, which has a lot of people scratching their heads. In fact, some reports quoting you as calling it the black sheep sort of mutation of COVID-19 because it operates so differently. How should we be responding to that? And now I'm talking about the country's response, mostly because we're seeing places like the UK being isolated, although not of their own will. Is that a prospect that you foresee for South Africa, us essentially being closed off to the rest of the world because of this new strain?
Well, the UK also have 501. I think their variant is number 1 because ours is number 2. So ours is a bit different of the UK. And I presume that we followed the same route because this mutation is unique to South Africa and you don't want that in another country. So, and again, the only way at this stage to help and assist a failing healthcare system is for people to be responsible, wear their mask, personal distancing, natural ventilation, and washing of hands. Then in the hospitals, we are again seeing that the PPE is not sufficient. It now seems as if everyone in leadership positions in hospitals are too afraid to order. So it just become a total mess in the end of the day. And on top of it, we're now getting young people in, the people just qualified, extremely inexperienced. That's for nursing staff as well as doctors. And, you know, with this new variant, if we do not protect them, this new variant also goes for the 20 pluses and not anymore for the 50s and the 60 pluses. So we need to make a plan.
One problem, it appears, begetting another. Thanks very much for your sobering reflections on this Tuesday morning. Certainly appreciate your time on the AM Report. Dr. Angelique Coetzee is chair of the South African Medical Research Council. I wonder what you make of where we are insofar as that is concerned, not least of which because a lot of these problems actually aren't new. One wonders whether something like a global health crisis is enough to finally shift the dial. A story we're certainly watching for you throughout the rest of the show.